treatment of cardiovascular system and blood disorders. So let us see first question. Digoxin is not used when heart rate is. Digoxin is not given or used when heart rate is below 50, below 60, below 70, below 80. And before that, the normal heart rate is 60 to 100 beats per minute. So when the heart rate is below 60, we should not prefer the drug digoxin. Okay, the next question. Dopamine is preferred in the management of shock because. Dopamine is preferred in the management of shock because it decreases cardiac output, it has prolonged action, or option C, has peripheral vasoconstriction effect, has renal vasodilatory effect. And the answer is B, has prolonged action. It has a renal vasodilatory effect. So this is the correct answer. So dopamine preferred in the management of shock because it has renal vasodilatory effect. And not only that, because of this function, it saves the organs from damage due to shock. Renal organ from damage due to shock. The next one, which of the following drugs should be first administered in the patient admitted with a diagnosis of acute myocardial infarction? Which of the following drugs should be first administered in a patient admitted with a diagnosis of acute myocardial infarction? Acute myocardial infarction, also called heart attack, acute heart attack. In this situation, which drug we should administer first? AC inhibitor, aspirin, calcium channel blocker, statin. And the answer is aspirin. So why? Because this aspirin is a powerful antiplatelet agent and it has the capacity to reduce the mortality by 20%, and the dose of aspirin is 50 to 300 mg. We can administer to the patient. Then next question, which electrolyte imbalance may predispose the patient to digitalis toxicity? Which electrolyte imbalance may predispose the patient to digitalis